The carpus is the anatomical term for the wrist which connects the radius and ulna of the forearm with the metacarpal bones of the hand. It is comprised of 8 individual carpal bones that are seated in 2 neat rows of 4. The proximal row of carpal bones, as seen in a lateral to medial direction on the palmar surface, include the trapezoid bone, the hamate bone, scaphoid superficially, anatomical snuff box, proximally, radius, distolaterally, trapezium, distamedially, trapezoid, superomedially, lunate, inferomedially, capitate, lunate laterally, scaphoid, medially, triquetral, inferiorly, capitate, triquetral distamedially, pisiform, inferiorly, hamate, laterally, lunate, pisiform dorsally, triquetral, lies within the tendon of flexor carpi ulnaris trapezium medially, trapezoid, superiorly, scaphoid, inferolaterally, first metacarpal, inferomedially, second metacarpal trapezoid proximally, scaphoid bone, laterally, trapezium, medially, capitate, distally, second metacarpal mnemonic. Trapezium is by the thumb, trapezoid is by its side, capitate proximally, lunate, distally, third metacarpal, laterally, trapezoid, medially, hamate palpable due to the hamulus mnemonic Sally left the party to take Kathy home, scaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, capitate, hamate. Clinical fractures, carpal tunnel syndrome. This article will now discuss the individual carpal bones in detail, as well as highlight the potential pathological conditions that can affect the wrist. The proximal row of carpal bones: scaphoid bone, lunate bone, triquetral bone, pisiform bone. The distal row of carpal bones: trapezium bone, trapezoid bone, capitate bone, hamate bone. Clinical aspects: scaphoid bone fracture, carpal tunnel syndrome.